Namaskar. I am Dr. Murali Manohar. Welcome to Ayurveda Samhita. In this program, you are going to learn about an important topic and some powerful ancient Ayurvedic secrets. These can change your entire life forever.
Kidney stones. Kidney stones are one of the most common disorders of the urinary tract. People whose diet is rich in animal protein and low in fiber and fluids are at higher risk of developing kidney stones. People working under high stress levels with a family history of kidney stones, patients who are bedridden, and people with high blood pressure are also prone to develop kidney stones. The incidence of kidney stones has been increasing over the past 20 years. On an average, men have an incidence of 1 in 14 and women of 1 in 30. People between the ages of 20 and 40 are more likely to develop the condition, as are those with persistent heartburn and those who take antacids for long periods. Crystals that form in urine and build up on the inner surfaces of the kidney can form stones in the kidney, the ureter, or the bladder. These stones contain various combinations of minerals and other chemicals, some of which are derived from your diet. Normally, urine contains factors that inhibit stone-building substances from forming crystals, like magnesium, citrate, pyrophosphate, etc. A deficiency in these protective substances can result in the formation of crystals. Changes in the pH of the urine that causes acid or alkaline imbalances can also affect stone precipitation. Other causes of kidney stones are a disorder of uric acid metabolism, gout, excess intake of vitamin D, and blockage of the urinary tract. Certain diuretics or calcium-based antacids may increase the risk of forming kidney stones by increasing the amount of calcium in the urine. About 70% to 80% of all kidney stones are composed of calcium, generally combined with oxalate. Oxalate or oxalic acid is found in a number of common vegetables, fruits, and grains. About 2% are composed of calcium phosphate. About 10% of stones are made up of uric acid, which is the end product of purine metabolism, a nitrogen compound found in protein. Another 9% to 17% of stones are struvite. They are made of magnesium ammonium phosphate. Struvite stones are usually associated with certain urinary tract infections. Symptoms. In many cases, kidney stones develop silently. You may not experience symptoms in the beginning. However, when symptoms occur, they frequently include severe pain and blood in your urine. Remember, the size of the stone does not necessarily predict the severity of the pain. You may notice blood in the urine if the stone becomes large. There may be nausea and vomiting. If fever and chills accompany any of these symptoms, you should suspect a urinary tract infection. Guidelines. A good step to prevent any type of stone is to drink plenty of liquids. Water is best. Minimize the intake of foods like apples, tomatoes, asparagus, beer, berries, black pepper, cabbage and cauliflower, cheese, chocolate, cocoa, coffee, cola drinks, figs, grapes, ice cream, milk, oranges, butter, pineapples, spinach, tea, vitamin C, and curd. Avoid food with added vitamin D and certain types of antacids that have a calcium base. If you pass acidic urine, you may need to eat less meat, fish, and poultry. Avoid sedentary lifestyle. At the same time, do not expose yourself to extreme temperatures and dehydrating conditions. Ayurvedic remedies. The bark of henna plant, Mehendi, is an effective remedy for removing urinary stones. Make a decoction by boiling 1 part of the bark in 20 parts of water until it boils down to 1/4 of its original quantity. Take this decoction in doses of 20 to 30 milliliters, twice or thrice a day. Alternately, take the decoction made from leaves and seeds of radish, muli, to expel the stones. Horse gram, delicious biflorous, soup is an excellent food supplement. Pashana beta and varana are the two important herbs, which have proved to be effective in the treatment of urinary coliculus. Either the rhizome of Pashana beta, in the form of powder, or the bark of varana in the form of decoction can be taken internally. Ksharapharpati, Shilajit, Ashmari Harakashaya, Chandraprabhavati are some of the effective medicines used to treat the condition. Gokshurakata is an oral liquid, promoting easy urination and relieves burning sensation. It should be taken 3 to 4 times per day in doses of 15 milliliters with equal quantity of water. Birpatharbhasma is another effective remedy. You can use them after consulting your Ayurvedic physician. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will meet with another interesting and important topic. Satam Jiva, Sarado Vardhamanaha, Satam Hemantan, Satam Vasantan. Live over 100 years old with excellent health and complete happiness. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.